Hi everyone. The aim of this presentation is to orientate you all to simulation in general and to also explain to you what to expect at the WITS Anesthesia Sim Day this year. Many of you would have attended a Sim Day for Regis already and feel that you do not need an introduction or orientation, but this will help to refresh your memory, so please watch it. So what is simulation? Well, simulations are scenarios that mimic real life situations. They allow for a safe and controlled environment to reenact stressful scenarios, and our aim is to reenact cases that may be rare, but that carry a high morbidity and mortality if not managed appropriately. It's a model of hands-on learning with the aim of reducing medical errors. It allows you to gain experience in high-risk situations. This year, we will once again be using high-fidelity mannequins. The mannequins are able to exhibit a variety of physiological changes in the cardiovascular, respiratory, neurological, and gastrointestinal system. Different companies will have different patient simulators. This year, we will be using HAL, which is an adult simulator, Sim Junior, and Sim Baby. You will be using HAL and Sim Junior at med school, and then Sim Junior and Sim Baby at Helen Joseph Hospital. So why are we doing it? Well, we're conducting this day as part of our anesthetic registrar training program. This learning experience supports your professional development. It's important to remember that this is not an assessment. There is not going to be any grading or reporting about your performance. Our purpose here is learning and development. And this activity gives you a chance to practice and learn. We aimed to create a safe space for learning. And to do this, we'll be utilizing principles from Rudolph et al. We want you to feel like a valued team member. We need you to understand that it's a safe space to learn and grow, meaning that it's okay and safe to make mistakes, to ask questions, and to receive feedback. It's safe to contribute, so speak up and explain what you are thinking. Also note that it's safe to challenge the instructor and team members. We request that you enter into a fictional contract with us. We understand that simulation is a fictional construct and that there will be elements that are not realistic, but we do try to make this experience as realistic as possible. What we ask of you is that when you engage in the simulation, that you treat it as a real life situation and see the patient as a real patient. So we request that you attempt to immerse yourself into the scenario. We ask that you are mindful of confidentiality. Please do not discuss your colleague's performance outside of the case and debriefing. What happens in the sim stays in the sim. Please also do not tell your colleagues that are not here about this case, as we will be doing these same scenarios throughout the year. Everything done as part of our anesthetic registrar simulation program is done based on this principle from the Center for Medical Simulation from Harvard Medical School. And it states that we believe that everyone participating in the simulation is intelligent, capable, cares about doing their best, and wants to improve. I'm now going to give you a brief introduction to two of the mannequins we will be using, Sim Junior and Sim Baby. You will be given a full introduction to HAL, the adult simulator, at med school. We will also do a hands-on orientation at the two sites before the simulations. Now, moving on to Sim Junior. Sim Junior is a realistic, life-size pediatric patient simulator. The airway is anatomically correct up to the trachea. It can be manipulated by head tilt chin lift, jaw thrust. Because it does have an articulated jaw, you can apply cricoid pressure and manipulate The mannequin may be ventilated by normal and emergency methods via bag mask ventilation. In order to get chest rise, you will have to have a proper seal, just like in real life. You can also insert a laryngeal mask airway, orotracheal intubation, and nasotracheal intubation. Now, specific sizes of airway devices will be suitable. You need to request whatever size is appropriate in your scenario, but you will be handed and expected to use a size that's appropriate to the mannequin. Okay, Sim Junior can simulate spontaneous breathing with visible chest rise and variable breathing rates. So you'll be able to see bilateral chest rise and fall with spontaneous breathing and unilateral chest rise and fall with right mainstem intubation during ventilations. You will also be able to hear unilateral and bilateral lung sounds, both normal and abnormal. There are only anterior auscultation sites, so you need to place the stethoscope over the speakers to hear clearly. We've marked these with stickers, so for the lung sounds, please auscultate over the blue sticker. To auscultate heart sounds, anterior location once again will be marked by a sticker. So please auscultate over the red or pink sticker. You will be able to pace, defibrillate, and cardiovert using live electricity. So please take all precautions that you normally would in real life. When you need to defibrillate, only defibrillate on the defibrillated plates. You will be able to palpate pulses. The only pulses that are palpable on Sim Junior are bilateral carotid pulses and then unilateral radial and brachial pulses on the left arm. If you do need to perform CPR, you will be able to, but please position your hands correctly over the sternal area. Positioning your hands too laterally can result in damage to the mechanics. Lastly, we're going to watch a short video on SimBaby. How will we run our sims? So you will be involved in 4 simulations, 2 at med school and 2 at Helen Joseph Hospital. You will be an active participant in 2 and an observer in 2. The active participants will be the anesthetic team that are taking over or starting a case. So handover would be given at the beginning. Remember, you are who you are, so please work within your usual scope of practice. There will be changes in the patient's condition, and as a group, you will be expected to manage the changes as you do in theatre. There will be a primary monitor which will be pointed out to you. All relevant changes will be seen on this monitor. Remember that this is not a lecture or a discussion, but a simulation. So you will be expected to perform actions and not just state that you would do something. For example, you'd be expected to actually inject drugs or actually perform CPR. There will be embedded simulated personnel who will be playing the roles of surgeons or theatre and anesthetic sisters. At times, they may make suggestions or give prompts. The observers will be expected to be quiet and essentially watch from the sidelines. At the end of each scenario, we will have a debriefing session where we will go over the case with the important learning points. At this time, the active participants and observers will all participate. I look forward to seeing you all on Wednesday.